Hello, let's talk about plantar fasciitis. This is an extremely common pain that people get. It's felt usually under the heel, although occasionally in the arch of the foot. It's essentially an overload problem. That overload can be something that's very obvious, such as training for a long run, going on a long walk, or prolonged standing that's not usual for you, or it can be very subtle. Often people don't know why they've got plantar fasciitis. The treatment for plantar fasciitis is essentially non-surgical. There are two things that surgery can help with, and they're structural abnormalities of the foot or a calf which is so tight that the heel won't fully go to the floor. That's quite an uncommon cause though. The treatment for plantar fasciitis revolves around various different aspects. Firstly, altering what you do. If you think you've got plantar fasciitis because you've been doing too much running, too much standing, etc., that needs to be decreased. Exercises are very important. Stretching the plantar fascia and stretching the calf are the predominant exercises here, but I'd thoroughly recommend seeing a physiotherapist, or at the very least going on to a website such as the NHS website to get some stretches to do. The next thing is standing. If you stand for prolonged periods of time, you should do so in a shoe that protects your heel. Memory foam trainers are probably the best thing to wear, and I'd recommend that nobody with plantar fasciitis stands up without shoes on for any period of time, apart from perhaps in the shower. When it comes to insoles, there's lots of different types out there. The first thing I'd recommend is type plantar fasciitis insole into Amazon or Google and see what there is out there. There are different things because there's not one perfect insole for each foot or each problem. Try fairly cheap insoles first of all. If they're not working, we can organise an orthotist to see you to provide a bespoke insole. Night splints are very useful. Most people haven't heard about night splints, but essentially it's a partial boot that's worn whenever the foot is not at 90 degrees to the leg. When the foot dangles down, the plantar fascia becomes lax and starts to micro-heal in a short, lax fashion. The first step after a night of sleep tears those micro-healing areas and gives a significant pain. What the night splint does is keeps the foot at 90 degrees to the leg and stops it getting lax, therefore leading to a decrease in first step pain and hopefully a faster resolution of your symptoms altogether. There are other things to be done, and one of those would be a shockwave treatment to the plantar fascia. Shockwave is essentially a mini jackhammer. It provides significant pressure and minor micro damage to the plantar fascia, essentially kick-starting the body's normal response. Injections can be given, although because plantar fasciitis isn't an inflammatory problem, giving an anti-inflammatory injection perhaps isn't the best thing. Most people will get some temporary relief from an injection, but when it comes to treatment, I would recommend shockwave in the first instance after doing the physiotherapy, altering the way you stand and walk, and wearing the different insoles and shoes. If you'd like to see me about a problem with the heel, I'd be very happy to have a referral, either directly from yourself or from your physiotherapist.